This is an abdominal examination aimed at third year medical students. My name's Anant, I'm one of the doctors here. Hi, Sam, is it?
Yeah.
Hi. Do you mind if I examine your tummy today?
It's fine.
Are you able to lie flat? Are you comfortable lie flat? Great, well done. I'll just get you to just undo the top button of your trousers as well and undo the belt as well. Is that alright? So just coming around towards the end of the bed, I'm just going to have a look at Sam in general. He looks comfortable at rest. Can you just lift up your head off the end of the bed? That's great, that's brilliant, and rest it back down again. And that will often pop out any divarication of the recti or any hernias that might appear, that wouldn't appear at rest. Can you just give me a cough as well? That's great, well done. And that again can pop out any hernias that might not otherwise be there. So take your time to inspect the patient and have a look around the room, see if there's any other clues as to what's going on. There isn't here, and there's nothing obvious from the end of the bed. So I'm just going to carefully start examining Sam directly. Pop out your hands for me like that for me, if you will. That's great. I'm just going to have a look for any evidence of finger clubbing, any leukonychia. Turn your hands over for me. Any palmar erythema. You can do Shamrock's test where you put the thumbs together. Already done that in a previous examination. There isn't any palmar erythema indicating chronic liver disease. That's fine. Looking up and down his arms there's lots of signs in the hands actually. There's probably about 20 signs of chronic liver disease in the hands. I won't go through them all today. Just looking up and down Sam's arms and shoulders and things. Sometimes people have tattoos that can indicate hepatitis C or such like. I'm just having a look at Sam's eyes. I'm just going to have a look in your eye if you don't mind. No evidence of anemia. Have a look down for me. That's great. No evidence of jaundice and sclera either. Open up your mouth for me. That's fine. Just lift up your tongue. I'm looking for any evidence of mouth ulceration. I'm looking at his dentition. It all appears to be completely normal. Fine. Just looking at Sam's neck. There's no obvious lymphadenopathy. I'm just going to have a feel of your neck if you don't mind. That's great. Just looking at his chest wall for any evidence of spina nevi. There aren't any. That's fine. More commonly they're seen on the back. And just coming down to his abdomen to inspect. There's no evidence of any scarring, no abnormal masses. Nothing obvious going on. Do you have any pain in your tummy at all, Sam?
No.
Okay, it's really important to ask that before you start palpating the patient. Okay, I'm just going to have a light feel of your tummy, okay? And I tend to do this in 9 different places, just moving down in sequence. And it's important actually not to do what I'm doing, but actually to look at the patient's face. So I'm just going to have a deeper feel of your tummy, okay? Just let me know if there's any problems. The way that I examine it, actually, I keep my hand flat and just flex the MCP joint. I see lots of people flapping their fingers around and using the other joints. I think you don't feel as much as if you had a flat hand actually. So keep looking at the patient's face when you do that. I'm not doing that very well. I'm just going to examine for any organomegaly now as well. Nice deep breath in and out through your mouth, Sam. That's great. It's important to start with the right iliac fossa all the time, because what you're looking for is hepatomegaly or splenomegaly, and they can really be very, very big, right down to the right iliac fossa. It's important to start all the way down there. Keep going, deep breaths. That's great, well done. And just inch your way closer to the costal margin on either side. So there was no palpable hepatomegaly on the right. Splenomegaly can be something much more difficult to feel. So I tend to work my way down the costal margin a little as well. There's no palpable splenomegaly either. I'm just going to have a feel of your kidneys if you don't mind. So the hand should be relatively central where the kidneys are, and relatively high up, about the level of about L1. And my hand on his back is just ballotting up. So the top hand just presses down the abdomen, and the bottom hand ballots up. And in normal and thin people, this is easily palpable. Is that right? Not in any pain? Okay. Some people do percuss down for a bladder as well in a moment. I'm just going to percuss up for the leverage. So Sam's liver span is about 10 or 12 centimetres in the midclavicular line. percussible splenomegaly either. I won't percuss down for the bladder. Okay. You can also do a percussion test for shifting dullness, which I'll demonstrate, but that's to look for ascites. I don't think there will be any here. The way to do that is to lay your hand in the midline with your fingers pointing vertically. So there should be areas of resonance on top and an area of dullness towards the side. So for example, if that was resonant at the top and dull at the side, Sam, could you mind just lean over towards the wall for me? Just roll yourself over. That's great, well done. And stop there. And ideally you should leave this for about 30 seconds, but with time limitations in an exam you can explain that. And leave it for perhaps about 10 seconds or so. And if that dullness that was here initially has now shifted away and the kind of bowel loops with it, gas-filled air in them, would rise to the top, so that would now be resonant if there was ascites, but there's no difference because there wasn't any. You could also just roll over again. I just want to have a look at your back if I may. And it's a spider knee bar, you often see more on the back, but there aren't any here. That's brilliant. Roll yourself back over. That's fine. So the last thing to do, just stretch your arms out front. That's brilliant. I tend to listen just in the epigastrium because that gives you an idea of whether there's bowel sounds and the characteristics of those, and also whether there's an abdominal aortic bruit at all. Some people listen out for renal bruits, and if you felt a mass or anything, then it's wise also to listen over that, depending on what it could be. So the last thing to do would be to check for peripheral edema again, and again have a bit of time to collect your thoughts and find out what's going on. That's great. Next Sam. To complete my examination, it may be necessary to examine the external genitalia, perform a digital rectal examination, and examine the hernia orifices.